Well, thank you very much for inviting me to come speak to you. And I always need to start off with a little disclaimer that you probably already know, but the talk tonight is an educational talk. I don't want anything to be misconstrued as medical advice because I'm not your doctor. And it's to give you some understanding of the background and training and what a naturopathic oncology specialist does, how we work with patients fighting cancer, and some of the tools and things that we use to help with that. I will talk about some specific herbs and nutrients and things like that. But again, the caveat is these things need to be reviewed by your physician or your integrative practitioner based on what treatment you're going through to safely and to utilize them. So the other disclaimer I'll say real quick is this talk I've done in various iterations to different groups, physicians as well as patients. And so there's a lot of information on the slides, and I'm probably going to skip through some of them. I did provide a PDF copy that to Rachel, which I believe she could distribute to you if you're interested and you have a little bit more detail. So let's jump in. So first off, my name is Elliott Edwards. I've been practicing for almost 20 years now. The last 14 of those years, I've been solely focused on integrative oncology. I worked at a cancer hospital in the Midwest, Cancer Treatment Centers of America, for about 8 years. In that setting, I worked right alongside medical oncologists, radiation oncologists, the surgeons, all of the providers. We worked as a team approach to support our patients going through their treatments and fighting their cancer. I moved back out here to the Portland area in 2017, and now work at Sage Cancer Care in Northeast Portland. So I always feel like I need to define what a naturopathic doctor is and what naturopathic medicine is. Some of you may already know, but it's still a somewhat unknown and unrecognized profession, though I will say in the Northwest, we are very much integrated into the healthcare community, and many more people know about naturopathic medicine. But just quickly to understand, we're a distinct system of primary care. Most of our providers, most of our doctors do more general medicine, family medicine approaches, providing natural approaches to a whole host of different conditions, with the understanding and philosophy that our bodies are wise and nature is wise, and we can support and heal many processes through those pathways. So in most instances, we're looking at diet, lifestyle, and utilizing things like nutritional supplements, homeopathy, et cetera, to help support our patients dealing with whatever condition they're dealing with. One thing that has been said, and is still somewhat true, is not everything that we use has as deep of research behind it. However, we can definitely say that that's changed significantly in the last 20, 25 years. We are seeing more and more research on natural medicines, nutritional therapies, et cetera, that do validate why these things have been used for hundreds, if not thousands of years. Naturopathic medicine as a profession was about 200, 250 years old, but we do draw from all different types of traditional healing practices and use them within our modalities, our treatments. So our education is at minimum 8 years of study. So we have to have our 4-year undergraduate studies. Mine was in physics and chemistry, which means that I had to do some additional biology classes for my prerequisites before I was able to get into the program. And then the Naturopathic Medical School, which is accredited and recognized by the Federal Department of Education, as well as the regional accreditors that accredit all the other colleges in the area. That's another at least 4 years. Some people will do a little bit longer, 5 years. Some people even do 6 years. But during that training, the first 2 years looks very similar to standard medical school. We study the same textbooks, we learn the same physical exams, blood work, all of the diagnostic criteria to understand and diagnose our patients. But the focus, as I previously alluded to, is using more natural things to help support the patient getting well. And so the second 2 years of our training becomes more and more focused on clinical training, where we're seeing patients in the clinic under the supervision of a licensed physician. After we've completed all those hours, we earned the degree Doctor of Naturopathic Medicine, the designation of which is ND. And then from there, we have to take board exams, national board exams, and then apply for and oftentimes take licensing examinations for whatever state we're going to practice in. So pretty rigorous training that we have, and again, very science-based. So again, we take a holistic view of our patients. We try to treat the whole person, body, mind, and spirit. And no matter what their issue is, we really do look and try to address as much of the determinants of health we talk about, as much of those as we possibly can, from diet and lifestyle, with the hope that we can manage things without as much invasive treatments. I will say that that is way more possible in the primary care setting, in the general medicine setting. In the oncology setting, I will be very clear that we don't have a lot of research or data that suggests that you can treat your cancers naturally. So what is naturopathic oncology? Simply put, it's utilizing naturopathic modalities alongside of conventional therapies to provide additional support for our patients. We typically are looking to manage side effects, to support the immune system, stimulate the immune system, and overall just support quality of life. But we're doing that safely in a way that's not going to interfere with the treatments that you're getting from the oncologist. So again, at CTCA, when I was there, it was a really great collaborative effort. We had all different providers working together, and it's just more tools and more support for the patient. As far as the training, so there is postgraduate training for naturopathic oncology specialists, 2-year residencies that are out there. Or if you don't do a residency, but you end up seeing more and more cancer patients, doing more postgraduate education and training, after you've achieved a certain level of experience and are accepted by the Board of Naturopathic Oncology examiners, you can take an exam and earn the FABNO degree, FABNO, which I got mine in 2013, which means that my recertification is coming up next year. So I need to get busy on that. So yeah, again, most naturopathic doctors don't specialize in any particular area, but this is an area I think that really requires you to specialize. There's so much to know in the world of oncology. And so that's one reason why I've become a FABNO. So let's move on. So yeah, I've kind of hit the basics on these couple of slides. Again, we're trying to use evidence-based or evidence-informed treatments to support the patients throughout their treatments. I look at the treatments kind of in different phases, based on what the conventional approach is happening. So if they're going through surgery, there's things they do for surgical support. Chemotherapies, there's things that we use to manage side effects of that, radiation, et cetera. As far as what happens in my visit, so I spend about 90 minutes during my first visit with my patients. Prior to that appointment, I've reviewed as much as I can of their history, looking at, records from the oncologist, looking at the most recent blood work, imaging reports, pathology, et cetera. I need to know a lot of detail up front to know, what should we be doing and what are our steps as far as the integrative approach. So I spend, like I said, 90 minutes with that first visit. My follow-up visits, I spend typically about 60 minutes. Sometimes they're a little bit shorter, but I see my patients as they progress through their treatments. Obviously, if there's new side effects or new issues that come up that warrants a follow-up, or again, as they progress through their treatments. So at each phase, I will see them and give them specific support for that treatment. I also get to do a lot of education. I oftentimes am asked detailed information about the diagnosis. I think sometimes, well, first and foremost, when you're first diagnosed, there's just so much information coming at you. All kinds of foreign terminology and information that is very hard to understand and swallow. So that's part of that first visit. I oftentimes am kind of reviewing and helping patients understand aspects of their diagnosis and treatment and so on, and then continue to support them through. This is a little graphic that I like that kind of looks at how we should view the care that we provide to cancer patients, the cancer patient being in the center and having other people surrounding to support them through the treatment. So, all right, so I like to point out that there's a reason why I have a practice and why patients come to see me, and it really is driven by the patients. Unfortunately, cancer is still a very difficult disease or set of diseases to treat, and patients are oftentimes motivated to find additional support outside of the standard conventional treatments. And there's been multiple surveys over the last 20-25 years, all of which have shown that many patients that are fighting cancer do seek out some sort of convention or integrative therapy. A lot of those patients aren't doing it necessarily. I think this study showed that there was about 11% of oncology patients had been using natural therapies prior to their diagnosis, but then after almost 60 people were, or 60% were using these therapies. And a lot of patients are using dietary supplements. More than half of these patients in this particular survey showed that they were using dietary supplements. And supplements are wonderful. They're oftentimes very safe, but they are the one thing that could potentially have interactions that we need to be cautious with and really need to have expert guidance in order to safely use them when you're on conventional treatment. So the downside of this, and this has been shown in, again, multiple different studies and surveys, the oncologist unfortunately don't know about this. And they oftentimes aren't asking, or if they ask, they oftentimes will refer the patient to speak with maybe the pharmacist or somebody else about the supplements, unfortunately. And this is not to, oncologists are brilliant in their area of medicine. But as I previously said, I went to school for a long time to be an expert in this area of medicine too. So, we should understand that there's some limitation as to the knowledge and experience with conventional practitioners in using these safely and effectively. Though the interest and the research is growing. So. Yeah, so the point being is, having a integrative team that can hit the different areas of interest for the patient, the different areas of medicine, is really what we as oncology providers need to continue to strive for, to have just more tools in our toolbox to support that patient. Yeah. I kind of hit this. The oncologists oftentimes are a little bit hesitant to talk about supplements because they don't oftentimes understand them. They didn't have the training in it. So, all right. So I'd like to also point out that there are limitations and challenges with natural medicine. And the first thing that I say, and it's a pretty strong and bold statement, but I cannot tell my patients that there is a natural supplement out there that has been shown in clinical trials to effectively treat cancer. Now, it doesn't mean that there isn't value and benefit, and it doesn't mean that there isn't any evidence of the benefits of some of these natural things, but we just are never going to have that head-to-head trial testing if curcumin works as well as adriamycin or any of the other standard treatments that conventional doctors, conventional oncologists are using. So I make that statement only because there's a lot of information on the internet that suggests that you can cure your cancer naturally. And as much as I wish that were the case, I just haven't seen it in my years of practice. And there's not a lot of research or there isn't any research that clearly demonstrates that. So the other thing that I also point out is most natural things are very safe. Most of the nutritional supplements, they're not synthetic, they're not foreign to your body. You consume them in some fashion through your diet. So they tend to be less toxic, less concerning for side effects. But that being said, they're not completely without possible side effects and toxicity. So it's just something to recognize. Just because it's natural doesn't always mean that it's safe. And so again, having expert guidance can be helpful for you. Evidence-based medicine too. This is a challenge. We need more research. I absolutely support research. And at the same time, we should understand that evidence-based medicine does have limitations. A lot of the research that are based on cell line studies, so in vitro or animal studies, we need to recognize that doesn't replace the need for human clinical trials. And there's a lot of times where treatments actually are shown to be effective in clinical trials, but we can't just automatically assume that they will necessarily be helpful in humans because we don't have the data to clearly show that. And the other thing, specifically to natural medicines, there's a lot of testimonials out there, and just remember that a testimonial or somebody's story, they may be very compelling, they may be valid from some level, but but they're not the same thing as research, where we're studying things in multiple patients to really understand how often it works and how well things work. So another caution that I point out, just from a very generic perspective, is when you're on a treatment, the idea of detoxing from that treatment is potentially limiting to that treatment. So after patients have completed all of their treatments, I absolutely support patients through different kind of rebuilding programs, detoxing, if you will. But while you're on a treatment, if you're using something with the goal of detoxifying, it's possible that you are making that treatment less effective. If you speed up the medication and getting it out of your system more quickly than it normally does, it may not actually do the work that we're wanting it to. Hopefully that makes sense from a conceptual perspective. The other thing that we also look for is things that might slow down the metabolism of a drug. If that happens, there's a potential that you could have more side effects because the drug is hanging out in the body a little bit longer and could potentially cause those problems. So these are the things that we're looking at and trying to navigate for the patient when we're working with them and providing recommendations specific to nutritional and herbal supplements. So great. And then, yeah, there's also the potential for a supplement to directly interfere with the mechanism of action of the drug. Great example of that is the drug Velcade that is used for a lot of hematologic malignancies that can be interacted and interfered with vitamin C. Green tea is the other one that interacts with Velcade. So there are potential interactions that could definitely decrease the effectiveness of the treatment, and we don't want to do that. So we definitely want to just be careful, cognizant. We don't want to change that metabolism. We don't want to make the drug inert. Another example that's really important to consider for breast cancer patients, if the breast cancer is hormone sensitive, there are a lot of herbs that have estrogenic properties that we probably should be cautious with. Not all of them would necessarily, feed the cancer or stimulate the cancer to progress. But if we're taking something that's really upregulating the production of estrogen, that's going to be counterintuitive and counteract the anti-hormone treatments that are given after all of the other treatments that are done. So, okay, so now we'll get to some of the fun things that I get to talk about with my patients and recommend based on what they need. First off, diet is always foundational for our patients. And whereas I wish I could say we know 100% this is the diet that you should be on to fight the cancer, again, there isn't clear data on that. There's a number of books and articles that are suggestive that a vegetarian or vegan diet may be the path forward. And for some people, vegetarian or vegan diet is great. Some people can't really function very well. I've seen that for certain patients, they actually need animal protein to feel nourished and energetic and so on. So there's a lot of diets out there: vegan diet, vegetarian diet. The other big one right now, which is the almost exact opposite of a vegan diet, is the ketogenic diet. And there's a lot of research looking at the ketogenic diet right now. the main type of cancer that does seem to be helped with the ketogenic diet is primary brain cancers or glioblastoma multiforme, possibly prostate cancer, but we need a lot more research on that. Other diets, anti-inflammatory diets, no sugar diets, alkaline diets. There's a lot out there, and these are things that I look to find what's best for the patients that I'm working with based on what their needs are. There are some superfoods out there, and these are not a mystery. A lot of people know all about them, but dark colored berries, cruciferous vegetables, fermented foods, healthy fiber, all of those things have some benefits, from immune support to even possible anti-cancer benefits. So we look to modify it and address that as best we can without causing stress for the patient. One of the challenges with diet is patients on treatment really can't lose weight, even if it's a healthy weight loss from a dietary change. If that happens, we kind of interpret it as potentially being a bad response to treatment, and treatment may be slowed down or delayed or reduced if that happens. So a lot of the diet work that I do with my patients do end up being after the fact, when they are ready to kind of build their system up and decrease the chance of recurrence. So here's a short list of highly researched herbs that do have anti-cancer benefits. Curcumin probably is one of the bigger ones that's been studied pretty extensively. Curcumin is derived from the herb turmeric, and it's one of the main active ingredients. And it has a number of mechanisms that can help, from decreasing inflammation to shutting down genetic switches or pathways that promote cancer cell production. And it even has been shown to increase the normal healthy die-off of the malignant cells. So that's a process known as apoptosis, if you've heard that. So Chamomilla sinensis, or green tea, is another big one. The main active ingredient in that is ECGC, and similar benefits as curcumin. One of my last favorite herbs is boswellia. And boswellia, the common name is frankincense, and you may have read or heard about using frankincense oil for its anti-cancer benefits. I tend to steer people towards the full extract of the boswellia plant. That's where most of the research was done. It has great anti-inflammatory benefits, some other anti-cancer mechanisms, and I use it a lot when patients are having musculoskeletal aches and pains. So what else do I use? So these are more nutrients and things that have been well researched. Melatonin, which most people know is a sleep aid, a natural sleep aid. It's actually a hormone that's produced in the pineal gland, which is deep in our brain, and helps support the sleep-wake cycle, but also plays into a host of different neurologic and endocrine pathways and immune pathways. And so a lot of research has been done looking at this 20 milligrams and how it can help kind of shift the immune system towards fighting the cancer, while also suppressing some of the inflammatory responses that oftentimes mediate the side effects, things like nausea, weight loss, cachexia, things like that. So there's some interesting data on melatonin, and I use it quite frequently with most patients. B vitamins have general immune support. They also help with energy. There is some question and controversy around B12 and folic acid for certain cancers, but the jury is somewhat still out on both of those. Nonetheless, I use B vitamins quite a bit. I sometimes use higher doses of B6 to help with neuropathy. Sometimes it works, sometimes it doesn't, but it's a good tool and good way to help support energy for sure. Coenzyme Q10 or CoQ10, this is another one that I feel like most patients should be on, specifically because it has cardiovascular support. And cardiovascular disease is still the #1 cause of death in our country. So the general population, a lot of people may actually have benefit from CoQ10. CoQ10 helps the body produce energy in the mitochondria. It has it's not a stimulatory effect, but over time, it really can help bring people's energy back up, especially after going through treatments. And again, the fact that it is supportive of the heart, there are a number of different chemotherapies that do impact the heart. They have cardiotoxicity, and CoQ10 may actually help to offset that. At least in some of the studies, it's been shown to do that. And then one of my most biggest interests is in medicinal mushrooms. There's a whole bunch of different types of mushrooms. Over 30 species at this point have been looked at and appear to have some medicinal properties. Traditional Chinese and Japanese medicine has used medicinal mushrooms for thousands of years. And even, most recently, as far back as the 1970s, there's been a lot of research looking at mushrooms, how they help support the immune system, and how they can safely be used with conventional treatments. There's a number of clinical trials that have been done in China and Japan that have used these concurrent with chemotherapies and then have seen some really good outcomes. So they upregulate the immune system, specifically the natural killer cells. And in doing that, it supports the body's own immune system to fight the cancer and try to get rid of some of these cells. It's kind of immunotherapy, which is a hot topic I'm sure you all have probably heard about. So one thing that I make a point of with my patients is that you can eat mushrooms if you like them, and there are some benefits to eating the mushrooms, but the immune stimulating benefits are best seen when we use a hot water extract of the mushroom. So when a patient wants to use it and it's safe for them to use it, depending on what their treatment is, I point them in the direction of a hot water extracted supplement, and you can just look at the bottle, and if it doesn't say that it's hot water extracted, it probably isn't. The bottle typically will say that's hot water extracted. Liver support. Now, these are things that we have to be really careful on because, again, upregulating or detoxifying the liver, that's where you are going to see a potential decrease in the effectiveness of certain chemos because we're getting rid of that more quickly than we should. But milk thistle, burdock, and dandelion root I use to help with liver support if liver enzymes are elevated and it's safe to use. I'll use some of these. Alpha lipoic acid is also another one, and I'm seeing more oncologists actually use alpha lipoic acid when patients are on taxane drugs to help manage and minimize the neuropathy, the numbness and tingling. N-acetylcysteine is something that you need to be very cautious with. I usually don't use it at all when somebody's on treatment because of its potential to interact and interfere with treatments. But it is something I use after the fact to help support glutathione production and things like that. There's a few other compounds that are very helpful for the liver that I sometimes use, phosphatidylcholine, as well as taurine and glycine. Those are more amino acids. Phosphatidylcholine oftentimes is derived from soy. And so again, there's a controversy of eating soy and soy products when you have a hormone sensitive cancer. So All right, and then again, this is more baseline stuff, but I'm always checking in on how patients are sleeping, make sure that they're getting good rest, making sure you're moving. Exercise may be the best medicine that any of us have. And what's challenging, of course, is when you're tired and fatigued from the treatment, exercise becomes a challenge. But believe it or not, there's evidence that if you're able to get some movement in and to do some exercise, it actually will help alleviate the fatigue. It also is a great way to deal with mental emotional stress as well. And stress is one of those things that's always involved with almost every condition that's out there. And yet it's one of the harder ones to address and to manage, but we got to figure out a way to do that. There's a number of mind-body techniques that I use to help employ patients feeling better and getting back on track from their stress management perspective. So this is just a list of different hospitals where naturopathic physicians have been working. In our area, Providence employs some naturopathic doctors, and OHSU employs a few as well. This is Cancer Treatment Centers of America, where I worked back in the Chicagoland area. But anyways, we're getting there. We're getting more docs interfacing and integrating with these hospitals. So just to quickly recap, many patients are looking for this support. They want to use natural therapies alongside their conventional treatments, and they can be, but it does take some understanding and expertise to help guide people what's safe and effective and evidence-based. Naturopathic oncologists, this is what we do. This is our expertise. So we look to support the patient through their process to manage those side effects, keeping their quality of life as high as possible, and to help decrease the chance of recurrence, when patients' treatments are done. Here's some information. Oh, I forgot to mention, so ONC-ANP, that's logo up here, that's the Oncology Association of Naturopathic Physicians. I've been a member since they started back in 2004. They have a lot of information. Right here's their website, oncanp.org. You can search there for naturopathic oncologists, or other naturopathic doctors that specialize or do a lot of cancer care. And so that's a good website to check out. This is my contact information, and I work at Sage Cancer Care, but my actual business, I'm a provider at Sage. My actual business is Northwest Naturopathic Oncology. So, and I think, yeah, it gets us to questions. And am I on time? I'm almost on time.